Sharita, and I'm the nurse administrator.
Hello, and I'm Shine. I'm the director of nursing.
And we are the boss ladies of
C.A.R.E. Welcome back to C.A.R.E Talks. First, we want to say that we're really excited because today is actually our first segment since we brought our introduction to you a few weeks ago. We also want to thank all of our viewers and subscribers that took the time to visit our page to view our video, like our video, as well as provide us with comments and feedback. So just so you know, we will be able to address questions and concerns that people do have if you provide them to us in advance prior to our next upcoming segment, like we're going to do today. We do have a question that was posted by a young lady named Yvonne that Sharita will go ahead and address.
So just like Shine said, I wanted to say thank you for subscribing and viewing our videos. So the question here states, how can I get a relative to buy into quality home health aid services? This relative currently receives home health aid services from a friend who is paid by a local agency, but the friend has poor work ethic, and I believe the relative is not successful with his treatment plan because he keeps hiring friends through the home health agencies. So, Yvonne, that's a great question.
How many people do you think are asking the same question? A lot of people, if you ask me, have concerns with the same type of situation. It's really good that Yvonne took the time to reach out with her concern because she's showing that she is an advocate for her loved one. So how would you address this today, Sharita?
So what I would say is the family member has something called a service coordinator, and this person is supposed to be the advocate for the family member. They are hired by the state to take care of.
Well, I mean, you are right. They are the advocate for the patient.
But they're also acting as a social worker. So with that being said, you can let them know that this family member has an aide that's not really taking care of them. They can do something called a pop-up. And what that is they just make sure that the aide is there and doing what they're supposed to do when they're supposed to be assigned to their family member.
Another important thing to piggyback off of what Sharita said is that the patient should try to be as open and honest with their service coordinator in order for the concerns to be really addressed and handled properly. The family member that has the concern can also try to be present, to be an advocate as well. The patient will also receive supervisory visits every 2 weeks from a nurse that's supposed to come out that is going to be checking on the patient, see if everything is being addressed in a plan of care, see what concerns the patient does have. And that's also another avenue where the patient should try to be open and honest with them as well in order for their needs to be met.
And also just remember that the patient actually is the
patient should be, they should be their own advocate, but you do have some situations where they can't speak up for themselves. That's where, family and friends come into play and play an important role in that.
Well, I was actually trying to speak on that they actually choose their care, choose their home health agency. What is it called?
Self-preference.
Self-preference. So they have a self-preference. So they can hire and fire whoever they want to at any given time. And the family member needs to know this, that they don't have to keep that person as an aide if they're not providing them with the care that they actually deserve.
Right, but one thing, that we're running into, where you said they have that self-preference, but sometimes you have the patients that don't want to hurt the loved one's feelings. They don't want to get rid of them because they don't want them to be upset, but they know that they need more care. So if you have someone on the outside like Yvonne, maybe it might help if she has a personal conversation and a private conversation with the patient to let them know that their care is the number one priority. Not about, if someone's going to be upset that they want to change caregivers. It's about making sure the patient's needs are met at the end of the day.
So our topic for today is diabetes. There are two types of diabetes. Diabetes type 1, which is juvenile diabetes, also known as. And with this, you are diagnosed as either a child or in your early adulthood. And then diabetes type 2 is adult onset diabetes. And most of the time, when you're diagnosed with diabetes type 2, you might start off as being on oral hypoglycemic medications such as metformin or glipizide. And with that being said, let's go into the topic of diabetes.
Well, Sharita did give, a few things in regards to type 2 diabetes. With type 1 diabetes, like she said, it's usually diagnosed in children, juvenile, or young adults. It's basically where the body is not producing enough insulin in order for your glucose to be within normal range. It's really something to be concerned about because we're seeing more and more people that are being diagnosed with this, and it's growing rapidly. Type 1 diabetes, it can actually affect your heart, your eyes, your nerves,
your kidneys,
your feet. So there's a lot of things that you want to be educated on and aware of in order for you to keep control of.
And also with type 1 diabetes, you are also on insulin. So a lot of times you have to check your sugar at least 4 times a day. You have to make sure that you have snacks, preferably in the morning or in the evening. And you also have to make sure that you're just making sure that your feet and everything, that you try to stay away from infections. So open wounds, they take longer to heal, and you want to make sure that you are keeping those wounds clean properly. So with that being said, being a skilled agency, we provide wound care, and we help our diabetics. Actually, we help their wounds heal a little bit faster with when you have a nurse involved in your wound care.
And just to jump off of a few of the things that Sharita did say in regards to making sure your feet and your skin are in order, you want to actually get into the habit of doing like a complete overall body scan. When you're getting out the shower every day, every evening, every morning, you want to make sure you're checking from head to toe to see if you have any new wounds or sores or any openings or cuts and things, because you want to treat them expeditiously. You don't want to wait around because, like she said, infection can set in. If you're diabetic, it does take longer for your wounds to heal, and it's more complicated than treating someone who does not have diabetes. So get into the habit of doing that. Also with your feet, you want to make sure you're not walking around barefoot because it's easier for you to injure your feet, if you're stepping on things, especially walking outside. Walking outside barefoot is really a no-no. So you always want to make sure, you do have a pair of shoes readily available before you go outside, and you want to make sure you're checking your feet daily. Even before you put your feet into your shoes, you want to check them to make sure there's nothing in there that you could step on.
And you also want to make sure that you have a foot doctor, and they're also called podiatrists, because they are to clip your toenails. You don't want to cut your own toenails because you don't know if you might cut too low. You can create wounds that way. You can also create ingrown toenails, which can have to be surgically removed at times. And you don't want you to have a wound infection on your foot and it to become gangrene, because that's how you get people with the toe amputations and the foot amputations. And sometimes when they just start cutting away, they end up cutting more later on in life.
Right. So you have to be cautious regarding everything. And still in regards to the feet and the skin care, how we discussed that it can affect your nerves. A lot of times you can end up with neuropathy. You might have some numbness and tingling, and it might affect the feeling in your feet. So sometimes you might not know that you might have an open wound, on the soles of your feet. So it's always important for you to check daily, put a visually, to your skin to make sure there's nothing going on there. And if there is, you want to get it addressed as soon as possible.
And also watch using heating pads, because a lot of times heating pads, if you have neuropathy, you don't realize how hot it is actually getting, and that can create a wound, burns and whatnot. So I just want to make sure that you know to take care of yourself and to what to look out for.
And Sharita did mention the importance of having snacks with you. While a lot of times everyone is looking at it as diabetes with you having high blood sugar, it can, depending on the treatment that you can have episodes of hypoglycemia, which is low blood sugar, and you might feel dizzy and different things. So you want to address that and know the symptoms of having a low blood sugar. So you do want to have different things readily available, like she mentioned, snacks and things. You can also keep whether you keep them in your car, in your purse, in the glove box, what they sell in the stores, over the counter, glucose tablets. And they're a really good source to have, if you feel that your sugar is a little low, you can pop one of the tablets, and it's a fast release, form of carbohydrate that will increase your sugar, so you don't have one of those hypoglycemic incidents.
And if you don't have that around, and let's say your family member is suffering from low blood sugar, you might, if they're coherent enough for you to give them something to drink, I would suggest that you give them some type of orange juice and some crackers to bring their blood sugar up really fast. But the crackers also sustains their blood sugar and everything. So
remember, as she said, you always want to make sure they are alert enough in order for them to be able to consume the beverage or the food properly, because if they're not, then that will lead to something else, which we don't want to, harm them anymore. But if there is a situation where they aren't coherent, you want to definitely,
call 911. Yeah. Call 911. That's it.
Emergency medical care.
Yes. Yeah. While you have trained professionals taking care of your loved one with diabetes in the hospital, C.A.R.E also has trained professionals where we provide them with the tools that they need to take care of your loved ones with diabetes also. And we also train family members. We have things like we have seminars. We also have in-services that we perform. We make sure that they know how to check blood sugars. We also make sure that they know what to do in the case of an emergency when taking care of your loved ones. And what you have to remember is that your family members, they come out of the hospital, and a lot of times they don't adhere to the same diet, the diabetic diet that they were getting in the hospital. So our professionals are trained to look at and read labels. They're also trained to know what to give the patient. The patient can't have Pepsi, you know what I mean? But they will go to the corner store sometimes and sneak a Pepsi, and you just have to watch for them to make sure that they don't go into a diabetic shock or coma.
A lot of times for the family members at home, they find it to be a difficult task to help their loved one be compliant with the diet that is being prescribed to them by the nutritionist or the dietitian upon discharge. But our number one goal is to make sure the patient does not go back into the hospital. We want to make sure the family members, the caregivers, our trained professionals have the tools that they need in order for the patient to be home for as long as possible and to be able to follow the care plan that's being provided to them.
I was thinking about DKA, diabetic ketoacidosis, which is when your family member, if they're diabetic, their sugar is high, they start having a fruity breath odor, or they're going to the bathroom more often. Sometimes they seem to be more sleepy than often, or they also eat more. Or eat less. So you want to watch out for that. But what I want to say, if you don't have the care or the help that you need, you can also call C.A.R.E, and we can get your family member started in the process in the right direction of getting the care that they need from a healthcare professional in the home.
And here at C.A.R.E, like we were discussing before, we do make sure the family members and our trained professionals have the tools that they need. We want to review with them the signs and symptoms of hypoglycemia, which is low blood sugar, or hyperglycemia, which is high sugar. We want to make sure they are paying attention to whether their patient seems more fatigued. Are they sleeping a lot more than normal? Are they complaining of urinating a lot more than normal? Are they up all night saying that, I've been up all night urinating? Are they less hungry? There's a lot of different things, that we want to make sure everyone is aware of. So if there's something that seems out of the norm, because the caregivers and the paid professionals are the ones that are the first to observe different things with the patient because they're there with them around the clock. So we want to make sure.
And we also have nurses on staff that if you feel like something is not right about your patient, that you can also call them and they will come and see the patient and they can determine if the patient needs to go to the hospital or not.
So as just to piggyback off of what Sharita said, our trained professionals, our skilled nurses will go out, do a further assessment. They will contact the physician right then and there while in the home to let them know what their assessment is and what their opinion is on the patient's condition at the time.
And we also call the hospital to let them know that the patient is on their way and that it is our patient, and give them a report on the patient so they know what to expect when the patient gets there.
So basically for us, I mean, we want it to be all around where everyone is in the loop of what's going on with our patient from the time that they're in the hospital, from while they're home. If there's anything going on, we want to keep the physician in the loop, absolutely. And we will contact and follow the patient to make sure we're up to date with knowing anything that's going on with our patient while they are hospitalized. So that will conclude our topic for today. If you do have any additional comments or concerns or would like some additional feedback, please feel free to post.
Or any questions and comments that you may have. So remember to like, comment, and subscribe to We C.A.R.E Talks.
And we'll see you soon. Take care.